welcome back to week 6 of Developmental Psych. This week we're going into chapter 11, which talks about physical and cognitive development in adolescence. Let's start out with our learning objectives: to be able to discuss the nature of adolescence, to be able to describe the changes involved in puberty as well as changes in the adolescent brain, to be able to identify adolescent problems related to health, be able to explain cognitive changes in adolescence, and be able to summarize key aspects of how schools influence adolescent development. Adolescence as a social construct. Adolescence is the developmental transition between childhood and adulthood, entailing major physical, cognitive, and psychosocial changes. Historically, children entered the adult world when they matured physically or began a vocational apprenticeship. In most parts of the world, adolescence lasts longer and is less clear-cut than in the past because puberty starts earlier and the amount of required training has increased for higher-paying occupations. An important physical change in adolescence is the onset of puberty, which is the process by which a person attains sexual maturity and the ability to reproduce. Puberty begins with a cascade of hormonal responses. The hypothalamus releases elevated levels of gonadotropin-releasing hormone, which in turn triggers a rise in luteinizing hormone, LH, and follicle-stimulating hormone, FSH. In girls, FSH leads to the onset of menstruation. In boys, LH initiates the release of two additional hormones, testosterone and androstenedione. Hormonal changes in puberty. Adrenarche occurs between ages 6 and 8. The adrenal glands secrete increasing levels of androgens that lead to the growth of body hair, faster body growth, and oilier skin. In the second stage, gonadotropin, the sex organs mature. A girl's ovaries increase estrogen, stimulating growth of the female genitals, breasts, and body hair. In boys, the testes increase testosterone, leading to growth of the male genitals, muscle mass, and body hair. The primary sex characteristics are organs directly related to reproduction. In the female, the sex organs include the ovaries, fallopian tube, uterus, clitoris, and vagina. In the male, they include the testes, penis, scrotum, seminal vesicles, and prostate gland. The secondary sex characteristics are physiological signs of sexual maturation that do not involve the sex organs, such as the development of breasts in females and broader shoulders in males. The adolescent growth spurt refers to the rapid increase in height, weight, and muscle and bone growth that occurs during puberty. In general, it begins in girls between 9.5 and 14.5, and usually at about 12 or 13 in boys. It lasts about 2 years and ends with a young person reaching sexual maturity. Sexual maturity is the maturation of the reproductive organs that bring about menstruation in girls and sperm production in boys. For boys, the first ejaculation occurs around age 13. It can be experienced as a nocturnal emission while sleeping. For girls, menstruation is the monthly shedding of tissue from the lining of the womb. The first menstruation is the menarche and usually begins between 10 and 16 and a half. Pubertal timing. There is a secular trend in the onset of puberty spanning several generations. A drop in the ages when puberty begins. A variety of explanations has been proposed, such as a higher standard of living and better nutrition may be a contribution. The role of body fat in triggering puberty is linked to rising obesity rates. Additionally, stress levels due to factors like being firstborn and harsh parenting practices may also be involved in the trend. Early maturation increases the likelihood of accelerated skeletal maturation and psychosocial difficulties, and it has been linked to adult health issues. Early maturing girls are at increased risk of anxiety and depression, disruptive behavior, drinking and substance abuse, antisocial behavior, precocious sexual activity, and early pregnancy. Early maturing boys are at significant risk for a wide variety of negative outcomes. The adolescent brain. Dramatic changes occur in brain structures that take place between puberty and young adulthood. The adolescent brain experiences a steady increase in white matter, connecting distant portions of the brain and improving information processing abilities. Pruning also continues throughout adolescence and results in fewer but stronger, smoother, and more effective neuronal connections, making cognitive processing more efficient. The teen years are often marked by impulsivity and risk-taking, possibly due to the trajectory of brain development. Peers tend to exert a stronger influence in adolescence, in part because of a heightened neurobehavioral susceptibility to social reward cues and concurrent immaturity in the cognitive control system. Physical activity. Regular exercise benefits teens in terms of improved strength and endurance, healthier bones and muscle, weight control, reduced anxiety and stress, increased self-esteem, grades, and well-being. Sleep. The American Academy of Sleep Medicine recommends that adolescents ages 13 to 18 years should regularly sleep a minimum of 8 to 10 hours per day. Only about 42% of middle school students and 27% of high school students get enough sleep. Sleep deprivation can lead to irritability and difficulties with concentration and school performance. In the United States, approximately 16% of high school students are overweight, and another 15.5% are considered obese. Overweight teens tend to be in poorer health than peers and are at heightened risk of hypertension, diabetes, and cardiac disease. Worldwide, obesity in children and adolescents has increased substantially, with the prevalence having tripled since 1975. Obesity has multiple causes, including excessive sugar intake, increased portion sizes, and a decline in physical activity. Common interventions include increasing physical activity, decreasing screen time, and promoting a healthy diet. Body satisfaction and disordered eating. Body image refers to descriptive and evaluative beliefs about one's appearance. Body satisfaction has been related to self-esteem, dieting, and disordered eating. Sometimes a concern with body image may lead to obsessive efforts at weight control. Anorexia nervosa is an eating disorder characterized by self-starvation that is potentially life-threatening. An estimated 4% of adolescent girls and young women and less than 1% of young men have been diagnosed. Early warning signs include secret, determined dieting, dissatisfaction after losing weight, setting new lower weight goals, excessive exercising, and interruption of menstruation. Bulimia nervosa is an eating disorder in which a person regularly eats large quantities of food, then purges the body with laxatives, induced vomiting, fasting, or excessive exercise. The disorder affects about 3% of young women and 1% of young men. Binge eating disorder involves frequent binging and a loss of control, but without subsequent fasting, exercise, or vomiting. People with this disorder tend to be overweight. Treatment and outcomes of eating disorders. The immediate treatment goal for anorexia is getting the patient to eat and gain weight. Treatments include behaviorally focused outpatient therapy and cognitive behavioral therapy. Bulimia is often treated with medication and cognitive behavioral therapy. Patients keep daily diaries of their eating patterns and learn ways to avoid the temptation to binge. Substance use. Most adolescents do not abuse drugs, but a significant minority do. Substance abuse is defined as the harmful use of alcohol or other drugs. Abuse can lead to substance dependence or addiction, which may be physiological, psychological, or both, and is likely to continue into adulthood. Currently, 21.3% of young people aged 12 to 17 received treatment for substance abuse in 2021. In the past 2 decades, there has also been a general increase in both prescription and street opioid use in the United States. Children ages 12 to 17 show the lowest levels of opioid misuse of all age groups. Worldwide, 26.5% of adolescents aged 15 to 19 were reported as current drinkers, and another 12% reported having consumed alcohol previously. Marijuana is by far the most widely used illicit drug in the world, and its use has become more common in the past decade. The reasons for alcohol use vary. Binge drinking is defined as consuming 5 or more drinks on one occasion and puts teens at particularly high risk. When compared with teens who do not drink alcohol, a meta-analysis of brain imaging studies showed that these teens who drank showed changes in key brain areas involved in executive control. Approximately 147 million people, or 2.5% of the world's population, reported using marijuana in the past year. Research indicates that marijuana use, particularly use that starts early or is heavy or frequent, is associated with decreased functional connectivity of the brain, poorer executive control, and declines in academic achievement. In 2020, 22.3% of the world's population used tobacco, with the bulk in low and middle income countries. Cigarettes kill approximately half of all lifetime users and increase the risk of multiple cancers. Tobacco use is on the decline in the United States and other industrialized countries, but the use of e-cigarettes is increasing. Depression. In the United States, in 2021, 20% of young people aged 20 to 17 experienced at least one episode of major depression, and only 40.6% of them received mental health services. COVID-19 increased rates of adolescent depression, stress, and anxiety. Treatments include psychotherapy and medications such as SSRIs. The leading cause of death among U.S. teens is motor vehicle collisions. Homicides and suicide are the second and third leading cause of death in the United States in those aged 15 to 19. Firearm-related deaths are far more common in the United States than in any other industrialized countries. Aspects of cognitive maturation. Adolescents move away from their reliance on concrete, real-world stimuli and enter what Piaget called the highest level of cognitive development, formal operations, the ability to think abstractly. Hypothetical deductive reasoning involves a methodological, scientific approach to problem solving that involves developing and testing hypotheses. An imaginary audience is a conceptualized observer who is as concerned with a young person's thoughts and behaviors as they are. A personal fable is the belief by adolescents they are special and their experience is unique. Language development. In adolescence, their vocabulary continues to grow, and by ages 16 to 18, the average young person knows about 80,000 words. With abstract thought, adolescents can define and discuss abstractions such as love, justice, and freedom. Adolescents are more skilled at tailoring their speech, using simpler words when talking with a child, swearing among friends, and showing deference to adults. In reference to adolescent morality development, when we look at Kohlberg's 6 stages of moral reasoning, adolescents are functioning within conventional morality and moving into post-conventional morality through their development. Research suggests that moral activity is motivated by both abstract considerations of justice and emotions. One researcher argued that men were biased, including Kohlberg, and viewed morality solely in terms of justice and fairness, but women held a different but equally valuable set of moral dictates. Prosocial behavior typically increases from childhood through adolescence. Girls tend to show more prosocial behavior and empathetic concern than boys, and this difference becomes more pronounced in adolescence. About half of adolescents engage in some sort of community service or volunteer activity. Students who volunteer tend to be more engaged in their communities and see better academic and civic outcomes. Self-efficacy and motivation. Western educational practices are based on the assumption that students are or can be motivated to learn. However, students who have high self-efficacy, which is the belief that they can be successful and achieve academic goals, are likely to do well in school. Gender. Reading tests conducted on 15-year-olds in 72 countries show an advantage for girls, although scores narrowed between 2009 and 2015. Although gender differences are small, boys performed slightly better on math and girls performed slightly better on science. Male and female brains show some differences in structure and organization. Social and cultural factors include home influences, school influences, and societal roles. Dropping out of high school. In 2019, in the United States, the dropout rate was 5.1%. Why are poor and minority adolescents more likely to drop out? Reasons include low teacher expectations, differential treatment, and less teacher support than at the elementary level. Dropouts are more likely to be unemployed or to have low incomes, to end up on welfare, or to become involved with drugs, crime, and delinquency. Other vocational issues. How do young people develop career goals and decide whether to go to college? Influences include self-efficacy beliefs, parents' value systems, gender stereotyping, and preferences for analysis versus creativity. In addition to the challenges of learning about and navigating the workplace, teens with chronic illness and child onset disability must also consider their complex health needs in an occupational context and learn to advocate for themselves. The challenges for teens with chronic illness and childhood onset disability can create barriers, with far fewer of these adolescents participating in the labor force when compared to non-chronic illness and childhood onset disability youth. Adolescents in the workplace. In the United States, about 20% of students are employed during a given school year. Researchers disagree over whether part-time work is beneficial to high school students, for example, helping them develop real-world skills, or detrimental, for example, distracting them from long-term goals. How much time students work matters. Those who work more than 20 hours a week generally suffer academically and are more likely to drop out of school.